Now I will explain the Diagnostic Imaging Tutor. This system is a service that provides knowledge, experience, and case studies of diagnostic imaging. It is composed of the Diagnostic Imaging Navigator, Doc.navi, and the Diagnostic Imaging Simulator, simu.Doc Basic and simu.Doc Practice. Let me introduce Doc.navi. Now, let's analyze this case image. You may choose either an image you want to study or even a real patient case. First, open Doc.navi from the homepage. This image can easily be mistaken for pneumonia, but in the bilateral lower lung field, you can observe a ground glass opacity. When you select this region and findings, possible diagnoses are highlighted in different colors. The darker shades indicate the more likely diagnoses, but you should not ignore the lighter shades either. If you find the finding difficult to understand, click the explanation button to see a typical example for reference. In this image, you can also observe a reticular shadow, so let's click on that as well. When we do, the list of expected diagnoses changes slightly. Click Case Search to confirm the diagnosis. By pressing Case Search, you will find 17 cases that show similar findings. You can review both the images and the explanations for each case. Among these 17 cases, the basic findings include ground glass opacity and reticular shadow, but in 6 of them, there is also volume loss. If you are not familiar with volume loss, you can click the link to see its explanation. This shows elevation of the diaphragm and loss of lung volume. Since this current image also shows volume loss in the right lower lung field, selecting that option narrows the list of cases from 17 down to 6. All of these examples come from actual university hospital cases, so the information provided is reliable. A fixed diagnosis is presented for each case. From these 6 cases, the most consistent diagnosis is interstitial pneumonia. Selecting interstitial pneumonia and pressing the output button provides details such as the explanation of the disease, treatment options, and lifestyle guidance for patients. By pressing the output button, a medical report is simultaneously generated below the navigation screen. Next, let me introduce simu.Doc Basic. First, let's log into the system. The learning content is divided into several sections: trial questions, a level check test, regions of abnormal shadows, abnormal findings, diagnosis, and a completion test. If your performance on the level check test is strong, you may skip simu.Doc Basic and move ahead. Now, let's click on Abnormal Findings. There are sets of 10 questions with difficulty levels indicated by 1 to 5 stars. Let's start with the 1-star level. At this level, the area of abnormality is already marked on the image. You simply select the abnormal finding. The example image can be enlarged to observe details, and the lateral view can also be selected for closer observation. If you click the bookmark, you can review a typical image of that finding. When you select your answer, The correct answer and explanation are displayed. Now, let's try a two-star question. Here, no area is marked, but a hint is provided. Select Ground Glass Opacity and Reticular Shadow, then click the Answer button. After answering, you can see the correct answer and explanation. At the 3-star level, there are no marks and no hints, so the difficulty increases. 4-star and 5-star problems are even more challenging. By clicking on the record list, you can review the total number of questions attempted and the number answered correctly. In addition, the Medical Shinensha database stores data from all users. If necessary, this information can also be provided. Now, let me explain simu.Doc practice. First, log into the system and begin your study session. simu.Doc practice includes 20 trial questions, 180 introduction questions, 340 beginner level questions, 360 intermediate level questions, and 72 advanced level questions. The recommended learning targets are medical students up to the beginner level, medical doctors up to the intermediate level, medical specialists up to the advanced level. Everyone should master trial and introduction. First, let's solve the first question in the introduction section, FA01. Looking at this image, we begin by selecting whether abnormal findings are present. In this case, abnormal shadows are observed on both sides of the hilum, so we select with remarkable findings. Once selected, the system prompts us to enter the region and the basic findings. Here, a hint indicates that the expected diagnosis is sarcoidosis. Since abnormal shadows are present on both sides of the hilum, we select mediastinum as the area and choose both sides of the hilum. As a result, the relevant findings are highlighted in the list. By clicking the book icon on the right, a detailed explanation of each finding is displayed. In this case, enlargement is observed on both sides of the hilum, so we select enlargement. When this is selected, sarcoidosis is highlighted as the expected diagnosis. However, if calcification is selected by mistake, sarcoidosis is not displayed, indicating an incorrect choice. This demonstrates the importance of understanding the relationship between the region, the basic findings, and the diagnosis. When enlargement is selected correctly and the Check the Answer button is pressed, the correct answer and its explanation are displayed. Next, scroll down and move on to DA01. As in the previous case, abnormal findings are observed on both sides of the hilum, so we again select with remarkable findings. Then, in addition to the region and the basic findings, the system prompts us to enter the diagnosis. We select mediastinum as the area and choose both sides of the hilum and the mediastinum. As a result, we are prompted to enter the basic findings. Here we select enlargement, then select the diagnosis and check the answer. When we do so, the correct answer and a detailed explanation are displayed. Finally, let's check the record list. Here, you can review the number of questions attempted and correctly answered at each difficulty level. Since all user records are stored in the database, this information can be provided if necessary. That concludes the explanation of simu.Doc practice. Thank you.